I want to introduce you to Dr. He is a therapist who sees children in Vancouver, British Columbia. He runs child play groups and does speeches. He's written books, and his main focus is dealing with children who he claims are transgender. And I wanted to just expose some of the thought processes and ideas that Dr. has and explain why they're so dangerous. I'm going to read to you some excerpts from a transcript of a speech that Dr. gave at a library. And I think that when you hear some of the things that Dr. is saying, you'll understand why I am concerned and why we should all be concerned about the current narrative regarding children with gender dysphoria. Dr. openly admits that kids can be persuaded or pressured or flexible in their gender expression. He says they can easily be encouraged to one way or the other. That may not be where they're supposed to be. Does that make sense? Right, young kids. So basically he's saying that kids are malleable, that depending on circumstances, that they can be encouraged to accept their gender or to reject it. And apparently in his case, he feels like his job is to support whatever gender identity the child presents with, even if that means that the child in the future will likely go on puberty blockers or cross-sex hormones or have surgery to mutilate their bodies. In this passage, Dr. talks about boys who come in and want to present as girls. And he says, they come in and they say, I want to be loved, I want to be wanted, I want to be accepted. And then he says they want to look like Victoria's Secret models. These are boys who are coming in for help. And instead of trying to identify what's going on there and help them find acceptance and love, he's suggesting that it's appropriate for them to try to achieve the goal of looking like a Victoria's Secret model. Dr. readily admits that the number of cases that he's seeing is increasing at an alarming rate. Well, alarming for us. For him, it's very lucrative, I'm sure. He says children are surfacing younger and younger, and the rate is increasing very fast. He says the youngest patient that he has is 2 3/4 years old. So they're learning how to walk and talk, and then instead of the first thing that they say is, Mommy, I love you, the first thing they say is, Mommy, I'm not a boy, or Mommy, I'm not a girl. These are children under 3 years old he's talking about. These are toddlers. And rather than suggesting that toddlers are creative in their thinking, that they need boundaries, that they don't really even understand the concept of transitioning. I'm just going to play a short clip in which Dr. talks about the number of kids in foster care that are coming to his gender clinic. And again, these are children who are in state custody. Most of them have been traumatized. They're in state custody because of their parents' inability to care for them. And it's almost like Dr. is proud to have so many of these vulnerable kids in his care.
So in our gender health clinic, we started in 2010. So back then, we started with 4 clients at the ministry, but now we have more than 500 kids under just the ministry alone. If I'm talking about my private practice altogether, I see more than 1,000. So that's quite significant now.
He notes that within 10 years, that's 125 times increase. Now, in any other kind of healthcare condition or mental health condition, if we had that kind of explosion of cases, we would be deeply concerned. But in this case, gender specialists are celebrating it. Dr. Young seems to accept common knowledge that of children who present with gender dysphoria, only about 20% of them will go on to be transgender as adults if they're not affirmed. And that's the key, if they're not affirmed. So Ken Zucker did research on this, and he found that if you just support children, that as they go through puberty, they will naturally feel more aligned with the sex they were born. He even mentions this. He says, Green did a study and only 2% of them will continue on to be transgender. That means if you have 100 transgender kids as a sample, only 2 of them will continue to be transgender. 98% of them will be gay or feminine, masculine, or cisgender. What he's admitting is that somewhere between 80 and 98% of children who have gender dysphoria will outgrow it if they're allowed to naturally progress through puberty without being affirmed. He goes on to kind of joke about it. He's like, hey, 20% of these kids will grow up and they won't be transgender. And he kind of jokes that people challenge as to why children should be socially transitioned. And his response to this is, think about it. I mean, if you go to the doctor and say, hey, I want to quit smoking, and I say, well, you know what, only 20% or 2% if will get lung cancer, knock yourself out. His response is basically saying that in other medical conditions, we don't discourage people from being healthy because only a small number of people will develop an illness or a disease if they're not healthy. Now, there's a fundamental difference here that is so critical, is that these kids, if they're allowed to naturally progress through puberty and they don't transition, their bodies will remain healthy and functional. Whereas if they start down the path to transitioning, and especially in a place like Vancouver where kids are encouraged to medically transition, their bodies will be permanently harmed by these treatments. And he's saying he's willing to harm up to 98% of children with these incredibly dangerous medical interventions in order to help the 2% that might grow up and be transgender. The fact that as a doctor, he readily admits these statistics and yet he's still willing to encourage and affirm children is shocking. He readily admits that he doesn't know which kids are the ones that are going to grow up and persist into adulthood. So when he talks to parents who have a child and they're not sure if maybe that child might be transgender or not, he suggests that they try it out. Go ahead and let the kid be Cinderella or Mulan or, dress up as a girl and see if they like it. Or let the girl dress up as a boy and see if they like it. Affirm them for a while. And if they like it, then go for it. Even though we know that children like to dress up, that's part of being a child. And if parents are excited about the child dressing up, the child's going to be even more excited about it. And if the child gets to control other adults about what name they're called and what pronouns that they use and where they get to go to the bathroom, then it's even more likely a child is going to embrace this. And the crux of this, though, is that Dr. readily admits that he can't tell which of these kids are going to grow up and persist into adulthood, and which, if left alone, would have their identity aligned with their sex at birth. And to me, this is beyond medical malpractice, that he's treating all kids as if they're transgender when he knows he can't even tell which ones are likely to be as adults and which ones are not. I want to make it clear that there is no diagnostic criteria for transgender. There is no test. There is no agreed upon litmus test to determine whether or not a child is transgender. A transgender identity is affirmed, but it's not diagnosed. And Dr. talks about telling parents that he has assessed their child and believes that they're authentically transgender, which I don't even know what that means, authentically transgender, but it gives the impression to parents that he's done some kind of formal and recognized assessment on a child to determine that yes, indeed, they're transgender. And that's just not true because there is no such thing. Diagnosticians like Dr. They have no way to determine whether a child is transgender, authentically transgender or not. That's not even a medical diagnosis. And then he goes on to say that when he tells parents that their child is very likely authentically transgender, they start to cry. The other thing Dr. says is not to wait. So if a child wants to start transitioning, he urges the parents to go ahead with it. He doesn't think that they should wait. And the reason is because he says that if children get the message that they should wait, that they might feel like there's something wrong with them and that their parents aren't supportive of them. And so he suggests that parents say, okay, if you want to do it, let's try it out. Dr. also admits that a large percentage of his clients are autistic. He says up to 20% of transgender kids will also have high-functioning autism. That's a huge number considering the percentage of kids with autism in the general population. It means that his clientele are overly represented as autistic. And this makes me mad because autistic kids have historically been mistreated and given inappropriate treatments. They've been given lobotomies, they've been institutionalized, and now we are systematically sterilizing them with puberty blockers and cross-sex hormones and telling them that they're born in the wrong body. And this is incredibly damaging to a child who is a very literal thinker, who is told that if you don't adhere to strict gender roles, that you're likely born in the wrong body, which is the narrative that these kids are getting. And for kids who don't have autism, they might understand the nuance of that. But autistic kids take things on face value. And so they believe that if they're gender non-conforming, it's likely that they're transgender. And we know that this is not true. So despite the fact that transgender activists say that gender identity is inherent and that a child is born that way, says 40% of the children that he sees showed no sign of a transgender identity until at some point they appear at his clinic. And this really harkens to the research Lisa Lippman did, where she identified something called rapid onset gender dysphoria, which is a social contagion. These are children who, for one reason or another, are using a trans identity as a coping mechanism. They are not inherently flawed, they are not born in the wrong body, and they certainly should not be given medications that harm their bodies. And for doctors to call them silencers and suggest that there are children who have had the transgender identity for their whole life, they just showed no signs of it, is ridiculous. And then Dr. talks about something that is very concerning. In fact, it did make the national media because it appears as though he's suggesting that parents and children should exaggerate or inflate the distress a child is under in order to get treatment because his clinic has so many patients. He actually says that the waiting list tends to be about 6 months, but if a child is under incredible duress, then they will make accommodations to get the child in sooner. So this is a message he's giving to either parents or children that they should maybe exaggerate the degree of the distress in order to get treatment sooner. And that is suicidality, running away, or cutting. And then they're able to get right into the clinic. And this is just infuriating. He says to parents and children, so you know what you need? You need to pull a stunt. Suicide every time. They'll give you what you need. He's encouraging children to threaten or attempt suicide in order to get what they want. He's telling parents that if they tell clinicians that their child is suicidal, they'll get what they want. Dr. ends the speech by saying something like 80% of these kids grow out of it. And then he says, I am so blessed that I'm seeing all the 20%. So lucky, just so lucky. So he's suggesting that the only children he sees are the kids that would persist into adulthood, even though he has absolutely no assessment. And he says he's blessed, and he's so lucky, just so lucky. We need to hold these doctors accountable. We need to stop accepting the narrative that children can be born into the wrong body and that their body can be inherently flawed and that doctors should affirm a child's self-hate and that a child is able to consent to medical interventions that will harm their bodies. We need to push back against this, and we need to stop doctors like who are affirming children at a very early age and suggesting that they are transgender when there is no diagnostic criteria for it. We need to fight against this because this is damaging our children. This is harming our society. In any other case, if we have children that are uncomfortable with how they feel, we don't suggest to them that the appropriate treatment is to damage their bodies, to self-harm. We don't do that. We try to help them to feel more comfortable with who they are. Please stand up. Please speak out. Please demand that this stops. We need to stop these doctors from doing any more harm.